many of you have a health insurance policy through your current employer? Okay, now I want you to remember back when you had open enrollment, your probation period was over, and your employer hands you this benefits package and says, okay, here are your options for health insurance. You have at least 3 options. One's an HMO, one's a PPO, one's fairly affordable, the other one's a little bit more expensive, and you think to yourself, do I go with the cheaper plan or do I go with the more expensive, thinking maybe you'll have more coverage? Okay, so what we're going to talk about today is the different types of health insurance plans that there are. Health Harbor Company has a website, healthharbor.com. They have a great website on everything insurance. In one of their articles, they list the 3 major types of health insurance. The HMO, which is a health maintenance organization, the more affordable option, but the more limited. The PPO, which is the preferred provider organization, which is the more expensive plan, but gives you a little bit more freedom. The POS plan, which is the point of service plan, is a hybrid of the two, giving you the best of both worlds at a more medium pricing. Okay, so let's look at the different types of insurance policies in more detail, starting with the HMO. The HMO, or PCP, is required. Primary care provider. Now, this doctor is the regular family doctor that you use for your yearly physicals or your routine medication refills, that sort of thing. If for whatever reason you need to see a specialist like a dermatologist or a gastroenterologist, the primary care doctor with this HMO plan has to refer you to the specialist before it will be covered by the insurance. Okay. The upsides to these are the co-payments and the insurance premiums. This is an actual example of an HMO benefit plan. Preferred Medical Plan HMO. I pulled this off the pmphmo.com, their website. Now, as you can see, the primary care physician office, flat copay of $5. He refers you to the specialist, flat copay of $10. You need an x-ray or an ultrasound, they send you to go have your testing done at the hospital. With this specific plan, no copay. You get admitted to the hospital through the emergency room. With this plan, 0 copay. The next option you have is the PPO, Preferred Provider Organization. This is the other extreme from the HMO. This one is the more expensive plan. No PCP is required. You can refer yourself to any specialist that you're looking to. You don't have to wait for the red tape and the paperwork to see whatever doctor you're looking for. As an example, the HMO, you can only use the doctors in the insurance plan. If there's a doctor that doesn't take your insurance, with that insurance, they're not going to cover it. You'd have to be paying out of pocket. The pro of the PPO is, if they're not in your network, you have out-of-network benefits. So you're paying more to be able to self-refer and also see doctors that maybe don't necessarily take the insurance. You're going to pay a little bit more out of pocket, but at least you're going to get some sort of discount based on the insurance. They will do it at a reduced fee. This is a just scenario, not of a specific policy or anything. Primary care doctor, regardless of what doctor you want to see, you can see a primary care 1 week and then the next month or the next week see a completely different doctor, and as long as they take the insurance, there isn't going to be any issue. Specialist visits are going to be a little higher as well, $50. The difference between the HMO and the PPO is when you start doing diagnostic testing or you get admitted to the hospital, you're going to have a deductible rather than a flat copay. Okay. United Healthcare, on their website, uhc.com, they list their PPO plan as having broad freedom of choice, but additional out-of-pocket costs applying to non-network care. Okay, lastly, let's talk about the POS plan. This is the hybrid between the two. No PCP is required, but they do recommend it. If you don't have one, at least you have a family doctor. You don't need it, but they do recommend it just to make it a little easier. You won't need referrals with this plan, and the difference is that aside from the HMO, they have in-network and the out-of-network benefits, so you have that perk of the PPO without necessarily so much of the cost. Because in this one, the office visit has a flat copay, the specialist has a flat copay. The only thing you may run into is the deductible and co-insurance amount if you maybe go out of the network with a doctor that doesn't take your insurance. With AvMed health plans, they have on avmed.org, they listed their POS plan as a referral-free plan with a PCP not required but recommended for routine care and the freedom to go outside the AvMed network. Okay. Did you pause it? So let's review the three major types of insurance plans. You have the HMO, the more affordable policy, but the more limited. The PPO, a lot more freedom, but a little bit more expensive. You are going to pay for the freedom to go in and out of the network. And the POS plan that is the hybrid of the two. Thank you.